I want to go ahead and welcome Dr. Tammy del Sol. Please introduce yourself. What do you do? How long have you been in the business? How long have you been a dentist? And tell me what you're up to right now.
Okay, so Dr. Tammy del Sol, I've been practicing general dentistry since 1995 in Harrisburg, PA. And my dad had the practice in the 50s, and then I took over. I just sold it a year ago, but now am back working part time in another practice in Anvil, which is very nice. And I have to say, not owning a practice and all that stress is much better, when you don't have that kind of stress. And I
Yeah.
really thought that I was struggling with doing dentistry, and I realized from getting this job in Anvil, without the stress, hey, there's no water coming in, room 9. I mean, none of that. I feel so much better. It's like the easiest job I've ever had. And
You can actually enjoy dentistry
it's
instead
it's
of,
nice. It's nice. It's like I
feeling
come
about
in and
everything else.
I get to help people, and then say goodbye at the end of the day. It's great.
Yeah, you're working a couple days a week, and then how do you spend your time, the rest of your time?
Well, I have this company, Herd Star Company, and I basically put this company together. I mean, carpal tunnel syndrome, as you have experienced yourself,
Yeah.
is very common in our field, and the problem is the handle design. I mean, when you really grip the heck out of this to use it, it can cause an injury over time. And the disconnect, the reason why I feel the manufacturers kind of stop before getting to the solution of this is because the engineers who are working on trying to figure it out only hear pinch grip, and they don't really
Yeah.
zone in on exactly when we pinch it the hardest. And so what I realized during COVID, when my office was closed for 4 months, a couple of years after my carpal tunnel syndrome surgery, I was like, okay, so when I hold the instrument loosely and do an exam, my hand didn't hurt. I wasn't creating, any pain points.
Yeah.
It was when I gripped it really hard, and I'm like, okay, so when did I grip it the most tightly? And I realized it was when I was using my mirror, for example, and retracting, when you're pulling against a force, taking that cylindrical handle and pulling. That's
Yeah.
the problem. And being left-handed, I got carpal tunnel actually from holding my high speed. So think about it. I mean, as a dentist, we have this diamond or this carbide in here, and we're drilling. We're drilling through old amalgams. We're doing circles around the tooth to do crown preps. Look how hard I'm holding that. My fingers are blanched. That pushing and pulling is really
Right.
deteriorates everything. And so it's the same type of injury as when the hygienist takes her curette,
Yep.
and she's and that is the life of a hygienist. They have to grip the cylindrical handle, get to the bottom of that tartar, and do this
Yeah.
pulling, and it's visceral. And then they talk about the chicken wing. Well, you can't help but get a chicken wing because that's the technique you
That's the
have. That's
technique that
you're
they show
using
you.
it. That's the
Yep.
only way to use it. So
Yeah.
so during COVID, I was like, okay, so we know it's when we retract, and this is literally how it happened. I'm like, okay, so when we pinch grip pull, that's when we have a problem. What do I have in my house that I'm pulling against the force, but I'm not doing a pinch grip pull? And like, screw it. I'm hungry. I'm going to go in the kitchen. I'm going to get something to eat. And I open my fridge, and I have my head exploded because I realized when you latch your fingers around an edge and pull, there's so much more strength. And it was like I was
Wow.
just putting chocolate in the peanut butter. And, I'd come up with my own version of Reese's peanut butter cup. I was like, holy heck, I have to create an edge on this handle. How do I create an edge? Many iterations later, I came up with this 5 fluted star. Okay. And so when you slide it on here, what happens is you're changing the whole design of the handle. So instead of pinch grip pulling, you latch your fingers like you're opening a fridge. You latch those fingers on the edge and you pull. Takes all the stress away. But then I realized the second best feature is we've got thousands of nerve endings on our fingertips that we do not use. It's 2026, and we don't use these nerve endings we've had for since our species began. We rotate everything wristwise, but now with the 5 fluted star, you can rotate digitally, and that's not been done in handheld instruments. So
No, it
I feel
hasn't.
like we're turning a corner here.
Did you have carpal tunnel syndrome in both hands, and did you have surgery in both hands, or was it only
No,
your left
I only
hand?
had it in my left hand. I'm left-handed. I have it in my dominant hand.
Oh
So, but
wow.
I know, like, you had carpal tunnel, but that was started, I think, with your pregnancy.
Yep,
But I
mine was a
know that
little
there's
different.
hygienists and assistants who have had that injury in both hands. Because if you understand dentistry, you understand your non-dominant hand is always holding a mirror, pretty much,
Yep.
to retract the tongue, while with your dominant hand, the hygienist is, removing the tartar, using the cavitron, using the profane, whatever they're doing.
How long did you practice in pain from like what you remember?
I think I practiced for like maybe, a good year. It just like I started with my arm going numb. Is that what happened with you? You had your arm going numb at night, or what were your symptoms of
My
carpal tunnel?
yeah, so it's funny because you don't know what you don't know, and until I actually experienced it myself, it opened a whole other world of just thinking because I didn't know. You hear about it, but when you don't experience it, it's just like not a concern, right? Because you don't know what it feels like, but it was
Yeah,
really
yeah.
painful. It started with not being able to scale too long. And
Uh,
then at night, my hands would go numb. At night, I would wake up with pain. I would feel pins and needles.
yeah,
And then it became excruciating to both hands actually. And it has to do with me being so swollen and it was pinching both nerves and
yeah,
everything else that I was doing. But I was working through pain.
yeah,
I think I was like about 6 months pregnant, 6, 7, 8, 9. So about 3, 4 months,
yeah,
right up to until I gave birth. But yes, it got a little better, but I was still pretty swollen. So
yeah,
it got significantly better, but I ended up doing surgery on both hands.
yeah,
It was
yeah.
pretty terrible.
Yeah, no, carpal tunnel is not for the faint-hearted. And the thing is, like, as a dentist, there's a little button on the high speed. You have to push to get the burr out, right?
Yeah, that's
I
really
had
hard, yeah.
lost so much strength, I didn't have the strength to push this button. So every time I needed to change this, I was handing my high speed to my assistant so she could push that. And that was because I had trigger thumb, which is another type of injury. My thumb would click. I had no grip. Like opening jars, I lost 75. I have struggled with jars now. 75% of my grip strength is gone. Do you still have problems opening things?
I don't.
Yeah.
After I had my surgery, I had a full recovery, but I ended up practicing afterwards. And yeah, I was very mindful of my hands and making sure I do stretches, but there's nothing out there. That's why I was so excited to work with you because this is the only solution I found out there that talks about and really helps clinicians and even outside of dentistry, right? Like you were telling me about hand specialists that has dealt with like different people that work in different industries, right? What other industries have you helped out with, like the star?
Well, I mean, I don't know if you can see this, but like, so the patent. So, long story short, I got a patent in May of last year, and the patent not only includes, these stars, it includes this clip-on grip. Okay, what's this clip-on grip? It snaps into the middle of handles like that, and it has a magnet on the end. So, number one, it makes the instrument more stable in your hand. It won't drop. When you're really pulling, it gives you more torque. But if you I feel like the future of dentistry is we're going to be, having a grab and go. We're going to be working. Dentistry is two-handed. So I think the instruments are going to be standing up. So when I got that together, I was like, huh, I bet you this could help other people too. So we created, utensils. I have a couple patients who have neuropathies in their hands.
Yeah.
And so we made these fork inserts. So this handle is something that I've created. I designed this handle, and as you can see, it has fixed, stars. They don't move. And it's a cone socket, just like all dental mirrors. And I
Yeah.
made these fork inserts with threads, and you put this in here, and all of a sudden I take my clip-on grip, I do this, and it helps these people with neuropathies be able to hold their forks more easily. And I designed this plate. It's an epoxy coated plate to go around, a plate. I'm left-handed, so it's on the left side, but it could go on the right side or whatever. And it allows
Yeah.
the instruments to just, they can just pick it up. And otherwise, the instruments are just laying down. And you're just, people. This is a way of also helping that group of people. We haven't launched into the occupational therapy world, but I've had a couple occupational therapists say, when is that coming out? Because I have patients who would love that. So I
Yeah.
know we have other potential. I know there's other things we can do. I have some other instruments here that, it can go on, pencils and pens and paintbrushes. I mean, you can rotate
I
without
use mine
it
on
can go
my
on a
pen.
screwdriver. It can go on screwdrivers and pens. And, when you put it on a toothbrush, get this. So when you put it on a toothbrush, Maria, all right, when you brush, so many people do this, the scrubbing, right?
Yeah.
And you guys tell them, like, stop scrubbing. You're wearing your teeth down. Don't do that. But when you put a star on a toothbrush, you have to hold it lightly. You don't do that, and it's so much easier. And you
Yeah.
can. But anyhow, so we'll get there. But we're starting here in these instruments.
I had the carpal tunnel, and I was dropping instruments like towards the end of my pregnancy, and I would come home crying. It was weighing, my grip was gone, and I don't know how I worked. It was terrible. But that would have helped me even through it. Like if I would
Yeah,
have had something like this, and I know I say it a lot, if I would have had the herd star or like the handles, for instance, while I was pregnant, while I was experiencing
yeah,
all of those symptoms, I know it would have been easier. Yeah, it was super scary because
yeah,
I didn't know what I was gonna do professionally, and then how long can I continue working like this? I only had a
yeah,
couple weeks left, and I was just trying to
yeah.
push through. It's such a great solution. I love it, and I can't wait
Thank
for
you.
like the world to know exactly what we've built here, because it's
But you know
incredible.
what? This design, Maria, has been. Do you know how many years this design has been around?
Oh,
Do you
I
know?
know, because my dad has been a retired oral surgeon, and a lot of his instruments are like teeny tiny where you can't even hold them and they slide everywhere.
Yeah,
But I mean,
yeah.
now they've come up with better instruments, at least different sizes and different thicknesses, but still.
So, I mean, the dental mirror was patented in 1892.
Yeah.
Okay, but this cylindrical handle. Do you know when they first came up with this?
I have no idea. It has to be really long.
Mesopotamia, 5,000 years ago. Okay,
Oh,
so
wow.
there was a language called cuneiform. Okay, and they would indent symbols in that language into wet clay tablets. And they used reeds that were growing around Mesopotamia, sharpened the ends, and had cylindrical hands. They were impressing these, letters, these symbols into that. Those were the first recorded cylindrical handles. We have used those cylindrical handles for everything since then. Paintbrushes and writing styluses and utensils, and there's everything that we pick up with our hand just about has a cylindrical handle.
Yeah.
But carpal tunnel and the injuries we have didn't start with dentistry. Imagine all
Yeah.
those scribes
True.
using those tools, writing and writing. How many times have you been writing before we had the computers? We're
That's
writing
true.
out our drafts and like our hand is just killing us.
Yeah.
It's the same thing. It's the same type of injury that we have now in dentistry.
Dr. Tammy, talk about your tongues, because that I
Oh,
wish I would have had when I was in dental hygiene school, because
yeah.
it's not realistic to have a typodont without a tongue, because as we all know, patients have tongues and you can't just magically remove the tongue and use your
As much as
instruments.
we'd like to, right?
Yeah, right. It would be, especially those patients that like
It would be
stick
so
their tongue
awesome.
out and push everything, and you're like, relax
Yeah.
your tongue.
Yeah, we're like, you know what? We're just going to remove your tongue for this procedure, but we'll put it back in. We'll sew it back in. Don't you worry. You leave with a tongue. So I mean, basically, I'm creating this star, and I'm like, how do I really demonstrate, latch pull, because typodonts don't include them, and
Right.
the typodonts that do have some, they're kind of really rubbery. They're not really lifelike. You have to dismantle the typodont to get to
Yeah.
it. So I'm like, okay, you know what? I need to demonstrate this. So I got squishy toys. And I'm like, well, they're the wrong color. And then I found a peach, right? And I cut it and formed it and super glued it on the bottom of my typodont.
Uh-huh.
And then a couple people who I'm demonstrating this like, wow, that's really cool. God, I wish I had that in school. I'm like,
Yeah.
huh. I'm going to see if I can find a toy company to make this for me. So basically, that's what I did. I found a toy company out of Jersey. We took, some measurements and figured it out and some iterations. And now I have this, I call it the RTA, removable tongue aid. There's Velcro. I cut out the bottom of this, so I got to the hard plastic, put
Yeah.
Velcro in here, put Velcro on the back of this, and it's easy. And you can take it in an hour. I would love to get this in dental schools and dental assisting programs, hygiene schools, because it really gives people an idea of what you're headed towards. Because so many students get out of school and they get to the tongue, I'm like, oh my God, what do I do with this, man? I'm like, yeah, they you missed that because that really wasn't part of their curriculum because we don't have typodonts that they could do it, but it's easy now.
Fine. And I mean, the good thing is it does come with, like fake calculus that you can scrape off, and that's wonderful.
Yeah.
But realistically, when you're trying to hold your mirror and your instruments, I mean, you're just kind of floating because you don't know. So it's not realistic.
Yeah. I mean, you're just retracting air. I mean, you have nothing. Now you have something realistic because this is realistically, and it's going to cover the teeth that you want to work on. So you have to pull it away and, work with your dominant hand on getting the tartar out or drilling out something or whatever it is, probing.
Well, COVID changed everything because I remember when I took my boards, I took it on a live patient. But after COVID, people were taking their exams with typodonts.
So I wanted to demonstrate in a big way what the difference is of when you're opening, this is an idea. When you open jars, because you're just compressing, you're using it so hard. And that's why I struggle to open jars. But why don't we make lids for jars that have indentations like this? So when you open, it would be so much easier because now you're using all those fingers.
Right.
It's not just it's not this, it's so much easier. So this was in a big way to try to demonstrate the difference of your hand, how you can use your hand more efficiently to accomplish things. So that's an idea. So anyone listening who is has a company that makes jar lids that are completely circular, heads up, put some indents in them and let us use our fingers. And the little old ladies everywhere will thank you. And someday I'll be a little old lady, but I feel like I'm an old lady now because I struggle with them.
I do too. I hate opening jars, and with the suction and everything, it's really hard to even open them. But
pickle jars and jelly jars, I don't know what they do. It's like they are old lady proof. I don't know. I don't know. It's not good. Just not good.
Well, I love everything that you're building, and I'm excited to continue working with you and spreading the word and the awareness, because we see loops and chairs and you see all sorts of ergonomic stuff for our bodies, but the most important part of all of it is our hands. We need our hands to be able to work, and you need to be able to preserve that long term, because I mean, I've only been practicing for 17, 16 years before I had to get surgery. Thankfully, I'm fine, but a lot of people may or may not be able to work afterwards. So
the statistic is 70% of hygienists are going to have a hand injury or some neuromuscular problem in the course of their careers. 70% is humongous. 7 out of 10 of you, and that's huge. And really, the manufacturers, Hugh Freedy and Shine and all these other big companies, I feel like they've given up, Maria. I feel like their attitude is like, well, maybe you just need a new chair. No, you don't need a new chair. Everything, the pain that starts to happen here in our hands. Do you know what I mean? The pulling we have is going up our shoulder, Sitting up straight is not going to stop your carpal tunnel. Having loops and lights is essential to do good work. But it's not going to keep you from having sharpened instruments are essential. And that can minimize some pain points, but that's not going to stop things. And I feel like we say these things because we know that those things are helpful, but they're still not addressing the problem.
Tell me, how can people order, and how do they come in packs of what?
Yeah, so we have 4-packs and 10-packs, and our 4-packs are in any of the colors. So in regular diameter, which fits most of the instruments that we have. We come in light pink and dark pink and blue and black. That's regular diameter.
I like the
if you
pink
have
one.
these little skinny
So pretty
mirrors, And if you have like these little skinny Explorers, any skinny handles, that takes the small diameter.
Yeah.
It has an internal star, and it only comes in black. So there's that. And also scalpels. I mean, I have a video of Sally Fayette. She's a surgeon, a friend of mine, and she uses it on her scalpel. And it's, I
Because
mean,
it's
this
so hard
scalpel,
to hold. It's just so thin and narrow.
look at this. This was designed also, 1892 was a popular year. The dental mirror and the scalpel was first patented. What's up with 1892? I don't know. But this hasn't evolved. It has not changed.
Yeah.
And it's miserable. It's miserable to like, you look at my fingers. But when you have this, it's easy. I can rotate. I have something to pull it night and day. And then those are the two sizes. We're coming out with the large ones that are going to be able to fit in onto scanners and piezo's in the fall. Okay.
Oh, that's amazing.
We're in the process of developing that. Okay. But so 10 packs, a starter kit is a 10 pack, and that has 8 regular diameters and 2 small ones. That's called a starter kit. And then you can get a 4-pack in any particular color, and in 4 packs in smalls, or any of the regulars.
What I like most about this is it's not as expensive as loupes or a dental chair. And mind you, a lot of hygienists will invest in their eyes, their chair, because it's important. But this is not expensive.
Yeah.
So even if your doctor doesn't buy you your practice, if you want to preserve your hands, if you want to make sure you can practice a long time, pain-free, invest in your stars.
So I mean, and if you see like this scaler, we have pink and blue, and you can color code. Yeah. You don't have to eyeball each one. Like, what side do I have? You can put them on Cavitrons.
I like that a lot because it tends to be very heavy, and it's a lot on your hands.
Yeah. No, you know what is cool about this is that when you're using this, look how I'm using this. I can move this like this, right? Do you see how I'm not just holding it along this handle, but when I take this off, the only way I'm going to move it is with my whole, do you see that?
Yeah.
You see how I'm using my whole hand here? But when I put this on, to use those nerve endings and tip it different ways that you cannot do without it. And herdental.com is our website that people can buy these things, okay?
Yep. Well, you guys have heard it. Visit herdental.com. Take a look at the stars, look at all the testimonials, the amount of people that have used these, not only in the dental field, in the medical field, and much, much more.
All right, Maria, thank you so much.
Thank you.
All right, take care now. All right, bye-bye.